So today's video is going to teach you the top 5 ways to tell if your dog has a CCL tear. All right, so the first one, I kind of already talked about this. It's limping all the time or limping intermittently. That means intermittent lameness. Sometimes they're using the leg and then sometimes they're not. The second way is if the dog is sitting with one of the hind legs winged out to the side or kind of straight out like that. A dog with a knee problem or a CCL tear feels pain when they sit nice and square with that nice pretty looking sit. When they're winging their leg out to the side, it actually relieves some of the pain that they're feeling in their knee. So if they want to sit like that, guys, let them do it. The third way is to check for a thing called drawer sign. Now this isn't something you should try on your own. Let a professional do it. That means either a veterinary orthopedist or your primary care vet. They'll check to see the movement between the tibia, which is the big bone down here, and the femur, which is the top bone up here. Those two bones come together like this, and in between is the joint. But also what's in there is the cranial cruciate ligament. That's the ligament that we're talking about here, the most commonly torn one, okay? The job of that ligament is to prevent excessive movement of the tibia, between the tibia and the femur as the dog moves. And there are lots of activities that your dog does that will stress out and stretch over time that ligament to the point of failure. There are lots of reasons, and I'm not going to get into it in this video. I will in another one though, of why the CCL tears. But drawer sign is when it's positive when there is excessive movement between those two bones. The cranial cruciate ligament is so stretched out, or it's torn, and it's longer than it should be, right? And it's letting that tibia thrust forward, and it's causing pain. It's not supposed to do that. So another thing is if your dog is really young, like a puppy, they have a little bit more ligamentous laxity. And what that means is their ligaments are like rubber bands, right? And those are what connect one bone to the next. I'm talking with my hands a lot here. So it's kind of hard to tell in a puppy if it's just puppy ligamentous laxity or if it actually is a CCL tear. The next way is to see whether or not, or to feel whether or not there is a medial buttress. And what that is an area on the inside of the dog's hind legs when you compare the non-painful side to the painful side. It's right along the medial or inside part of the top of the tibia. Again, this is something that a vet could easily feel. And what they'll do is they'll be behind the dog and just palpating or rubbing along the side of the inside part of the dog's thigh to see, is there kind of a swelling there or a lump there? That is a medial buttress. It's the dog's body's way of kind of trying to heal and stabilize that excessive movement in the knee joint. Then the last way is to get some x-rays done. Now I know if you've read some, you probably know that ligaments aren't even evident. They're not even visible on x-ray. So then do you really need them? And the answer is yes, I think you do. Here's why. There are signs that will show that the CCL is torn, and those are the presence of arthritic spurs called osteophytes. When a bone is irritated over time, the body wants to kind of repair it. And so what it does is it calls in these little tiny cells, and they grow and grow and grow, and they form spurs. These spurs can indicate underlying cranial cruciate ligament damage. Okay, so that's one thing. The next thing is joint swelling or effusion, meaning the tissues around the knee joint might appear swollen as a secondary kind of symptom to the CCL tear. Congratulations, because now you know the top 5 indicators of CCL tears. And that's great because now you've got the ability to get your dog into the vet and get their pain controlled. You can work with the doctor to get prescription medications to help your dog with the pain and inflammation. And believe me, working on this quickly, getting your dog seen quickly, enables you to then have a bit of time to figure out which way you want to go, whether it's conservative management or if you want to look into getting surgery. Now I know this stuff is scary, but now you're empowered to make better decisions on behalf of your dog. If you like this video, you've got to watch the next one because it's going to teach you what a CCL is and why it so easily tears. Thanks for watching. If you've had any struggles trying to figure out what's going on with your dog, be sure to drop a comment below. I'd be so happy if you'd help my channel grow by subscribing and then clicking the little bell icon to get notifications. Whenever I post a new video, you're going to be the first to know. Thanks so much for watching.